Hello everyone, my name is Dr. Anira Khan. I'm an environmental epidemiologist at the School of Public Health at Imperial College London. I've been working on climate change, water salinity, and the impact on health for the past decade or so, especially focusing on South Asia. Today I will be talking about the intersection between environmental change, salinity in water, and the impact on health. So in the next slide, we will look at the global burden of non-communicable diseases and the vulnerability of certain regions, and then look at some of the pathways through which climate change can trigger the risk of non-communicable diseases. Then I will be talking specifically about how rising water salinity as a result of environmental change affects millions of people living in the coastal areas and have implications on human health through freshwater shortages and through the deterioration of quality drinking water. I will be presenting a case study from Bangladesh where my team and I have conducted a number of epidemiological studies. Lastly, we will be looking at some of the interventions that have been explored and the way forward. Non-communicable diseases cause 41 million deaths each year, which accounts for approximately 74% of all deaths globally. Among them are more than 14 million adults between the ages of 30 and 70 who, in the words of the WHO, die too young. Low and middle income countries account for approximately 86% of the burden of premature deaths from non-communicable diseases, reflecting what has been known for nearly half a century as the epidemiologic transition. The economic implications of non-communicable diseases are substantial, with a projected cost to the global economy of $47 trillion over the next 20 years. And particularly in low and middle income countries, non-communicable diseases slow economic development and trap millions of people in poverty. Now, climate change increases the risk of non-communicable diseases through a variety of direct and indirect pathways. Environmental risk factors are considered as an important cause of disease burden, but the impact on non-communicable diseases is recently being considered and established. It is likely that the interdependence of climate change, environmental risk factors, and non-communicable diseases as a whole poses great threat to global health. This is important because the global and shared risks associated with climate change have the potential to affect sustainable development pathways, and both pose a disproportionate burden on low and middle income countries that are unprepared to cope with their synergistic effects. Now, if we look at climate change and health, some of the key pathways to health impacts include increased frequency and intensity of extreme events like floods, droughts, storms, and heat waves, sea level rise, biodiversity loss, and decline in freshwater availability, and changes in the quality and quantity of drinking water. These factors can in turn have extensive adverse impacts on health. Of course, there are the direct and acute impacts on health like deaths and injuries and infectious diseases from cholera, etc. But there is also a significant threat on the risk of non-communicable diseases like cardiovascular diseases, malnutrition, diabetes, hypertension, and mental health conditions. Now let's look at water salinity as an environmental risk factor. Salinity intrusion in coastal areas is an important and growing environmental hazard. Globally, in coastal areas, seawater intrusion has become a pressing problem. In countries like Bangladesh, Vietnam, Brazil, the Netherlands, increased salinity has contaminated surface and groundwater. And coastal populations around the world that rely on groundwater for drinking experience cumulative sodium concentrations in their sources of drinking water consequently. Climate change, including sea level rise and more intense cyclones, is one of the main drivers of this problem of salinity. Around 40% of the world's population lives within 100 kilometers of the coastline, with the numbers rising rapidly. The pressure on coastal freshwater resources, especially groundwater, is massive. Water salinity has been identified as an increasing public health concern affecting thousands of households, especially those that live in the coastal areas. Now let's look at some of the impact of rising water salinity. Salinity affects the quality of drinking water and water for irrigation, which could have serious economic, social, and environmental consequences for both rural and urban communities. Salinity also causes significant changes in the aquatic ecosystems. Rising salinity in soil can impact agricultural production and impact food security. Salinity impacts biodiversity as well. Much of the natural vegetation of salt-affected areas can be destroyed or damaged, which causes major changes to the landscape and biodiversity, including the destruction of many agricultural areas and the fragmentation of many wildlife corridors. This is a map of the coastal zones in South and Southeast Asia showing coastal drinking water vulnerability. Salinity is a widespread problem along the Asian coast, mainly in reclaimed lands where most people live. The red zone shows high vulnerability areas, which you can see are concentrated in the delta zones. Several factors affect coastal drinking water vulnerability, including elevation, which is distance above sea level, geomorphology of the countries, the population density, the amount of rainfall, availability of groundwater, and vulnerability to cyclones and storm surges. And it's been shown that episodic inundation events cause widespread salinization of surface water and groundwater bodies in coastal areas. If we look at the elevation map of South and Southeast Asia, you will see that many of these deltaic regions are just a few meters above sea level. In the map, you can see that the Bengal Delta is deep purple. Also, the Irrawaddy Delta and the Mekong Delta are just 1 to 2 or 3 to 5 meters above sea level. These low-lying areas are particularly vulnerable to the impacts of tropical cyclone-induced storm surges, which bring in the salt water from the sea to the land. In the Bay of Bengal, for example, frequent inundations of the area by saline water caused by storm surges arising from Category 4 and 5 tropical cyclones increase salinity levels of both surface and groundwater. Such inundations can result in long-term salinization of soil as well. Now, if you look at Bangladesh as a case study, the coastal community in southern Bangladesh are on the front line of climate change because of rising sea levels that go beyond 2100, even if greenhouse gas emissions are stabilized today. So it's crucial to understand the potential impacts because millions of people live there and are vulnerable to the impacts of salinity. Bangladesh is in the Ganges Delta. The geomorphology of Bangladesh has always made the country inherently vulnerable to natural disasters like storms, cyclones, floods, and seawater intrusion. The southern coastal region is only 1 to 3 meters above sea level, which has resulted in seawater contamination of drinking water sources. Other factors that contribute to rising salinity include upstream withdrawal of freshwater, over-extraction of groundwater, construction of dams, and shrimp farming. The cumulative effects of salinity, arsenic contamination, and drought pose threats to the water quality and security there. Here you can see the impact of the tropical cyclone Sidr that occurred in 2007 in the Bay of Bengal. It was a Category 5 tropical cyclone. There was extensive flooding in the coastal areas of Bangladesh with many deaths, and millions of people were displaced due to damages to their homes. The estimated number of deaths were approximately 3,300, and storm surges reaching up to a height of 3 meters were reported in the coastal areas, and this brought in substantial amount of saline water inland. This is a simplified causal diagram between salinity and health. As I mentioned, climate change related factors that include rainfall and sea level rise influence the amount of runoff, river flow, and saltwater intrusion. And through inundation, salt water seeps into the surface and groundwater, which are sources of drinking water for many populations around the world living in the coastal areas. And salinity in drinking water has adverse health impacts, some of which we will discuss now. The World Health Organization recommends a maximum daily intake of 2 grams of sodium. In the UK, most of our intake comes from food, but in coastal Bangladesh, the concentration of salt in water sources far exceeds this limit if we consider that people drink 2 liters of water each day. And this is before the intake of salt from food. This has serious implications for the health of the population, as excessive sodium intake increases the risk of hypertension and cardiovascular events, for example, stroke and heart disease. Epidemiological studies have shown that salt is the strongest risk factor for hypertension. There's a positive dose-response relationship between salt intake and raised blood pressure, which is hypertension. And hypertension is considered to be the most important cause of cardiovascular diseases, accounting for 62% of strokes and 49% of coronary heart disease. In Bangladesh, salinity in drinking water has been linked to increased risk of cardiovascular diseases, cholera outbreaks, spontaneous fetal abortion, infant mortality, abdominal pain, skin and diarrheal diseases, and lower neurodevelopment outcomes in children. However, further research is needed to look at some of these health impacts and further validate these results, especially looking at the long-term impacts like non-communicable diseases. Now I will speak about the population-based epidemiological study that our team at Imperial conducted in Bangladesh. It's interesting because it gives a very real picture of how climate change is actually affecting populations around the world, especially those in low-income and vulnerable settings. So in 2008, this issue of water salinity first came to our attention. We conducted a hospital-based survey and found that the rates of preeclampsia and gestational hypertension, which is hypertension in pregnant women, were much higher in the coastal areas of Bangladesh compared to the non-coastal areas. And after exploring this further and conducting a number of surveys with environmental and health data, and speaking to local communities, local doctors, and different organizations, we speculated and hypothesized that salinity could be the reason. And we investigated this further through a prospective cohort study. This is significant because non-communicable diseases in pregnancy are becoming increasingly important in contributing to death and poor health. Hypertensive disorders in pregnancy in particular are among the leading causes of death and disabilities in women of childbearing age. It can persist for years and predispose to long-term cardiovascular morbidity and mortality. It's a recognized risk factor for future cardiovascular diseases. There's also substantial differences in the rates of maternal mortality between high and low-income countries. The average lifetime risk of dying from pregnancy-related causes in high-income countries is 1 in 53 women, while in low-income countries, it's 1 in 49 women. And out of all the standard health indicators, this measure shows the widest disparity between rich and poor countries. Going back to the study in Bangladesh, our objective was to test the hypothesis that excessive saltwater intake is associated with the risk of developing preeclampsia and hypertension in pregnant women. We then conducted a population-based case control study to explore the association between drinking water salinity and the risk of these disease outcomes. This is a map of Dhaka, a coastal village in Bangladesh where we from Imperial College conducted the study and tested the hypothesis. We collected data from a cohort of 1,500 pregnant women living there and measured sodium levels from their water sources. We also measured urinary sodium levels and collected information on their lifestyle factors, socioeconomic factors, diet, etc. The health outcomes were preeclampsia, eclampsia, and hypertension in pregnancy. In this population, the main sources of drinking water include rainwater, pond water, which is sometimes filtered, river water, and groundwater, which is obtained from tube wells. In the figure, you can see that the yellow line is the recommended level, while the blue line is the taste threshold. We found that salinity levels in all the villages in the study area were consistently high in all the water sources except in rainwater. Both pond and tube well water, which is groundwater, are above the recommended level as well as the taste threshold. Now, people are drinking this surface and groundwater straight from the source. While the maximum sodium intake according to the WHO guideline is 200 milligrams per liter, the sodium concentrations here are much higher, and groundwater had the highest sodium level. So we concluded that the DACO population are consuming salt from drinking water alone at much higher level than what is acceptable. Consistent with that, when we measured sodium levels in the urine of the study participants, we found that the concentration of sodium was the highest in those who used groundwater as their main source of drinking water, followed by pond, which is surface water, and it was the lowest for rainwater. Again, consistent with the previous findings, when we looked at blood pressure, both mean systolic and mean diastolic blood pressure, we found that it was much higher for women who drank groundwater, which had the highest sodium concentrations, compared to those who used other sources and compared to rainwater users. We then calculated the risk estimates for preeclampsia and gestational hypertension. Now, when we analyzed the data from DACO, we considered factors that are independently associated with hypertension, like age, socioeconomic status, physical activity, diet, and previous medical conditions, among others. After adjusting for those factors, we found that compared to rainwater users, the adjusted risks of preeclampsia and gestational hypertension were significantly higher for women who used pond water and tube well water as their drinking water sources. The adjusted disease risks also increased in a significant dose-response manner for increasing quartiles of sodium concentrations in drinking water. This means that those who drank water with 900 milligrams of liter and above had a higher risk of developing preeclampsia and hypertension compared to those who drank water with 300 milligrams of liter of sodium. This shows a very clear association between high sodium levels in drinking water and the risk of developing preeclampsia and hypertension in this particular population. Analysis of non-pregnant adults within the same population in DACO showed that sodium concentrations in drinking water were strongly associated with blood pressure, and this is after controlling for personal, lifestyle, and environmental factors. And the analysis also showed that switching to a drinking water source with lower levels of sodium reduced blood pressure in adults. Now, in the next slide, I will show a short video of the study in DACO, which may help to better understand the situation that the local communities are confronted with.
The 40 million people of Bangladesh living in its coastal regions stand at the forefront of climate change and natural disasters. Now, an emerging environmental and public health crisis of water salinity contaminates the domestic ponds, rivers, and groundwater which communities rely on for their drinking, cooking, and agriculture. Approximately 20 million of this total coastal population are adversely affected by this salinity in their drinking water, which has already encroached over 100 kilometers inland.
মানে কেমন একটা লাগে পানি খাইতে গেলে বমি বমি ভাবে লাগে এখন অনেক দূরে টানতে হবে ওই চাল না না ওই খাটালি গাঙের পানি আনতে হবে তাও নোনা পানি খাই আর হয় না অনেক কষ্ট হয় পানি এনে খেতে অনেক দূরে যেতে হয় মেলা দূর এখান থেকে সকালে গেলে 9টা 10টা আসতে মেলা দূর যাইতে হয় পাস্তা পেটে করে কষ্ট কে এনে দেবে আমার যেতে হতো
উপকূলীয় অঞ্চলে জলবায়ু পরিবর্তনের প্রভাব নারীদের উপরেই কিন্তু বেশি পড়ছে সংসারের দৈনন্দিন প্রয়োজনীয় পানি বিশেষ করে খাবার পানি মেয়েদেরকেই আনতে হয় বাড়ির আশেপাশের পুকুরগুলো যেহেতু লবণাক্ত হয়ে গেছে মেয়েদেরকে অনেক দূর থেকে খাবার পানি নিয়ে আসতে হয় যেটা নাকি কিছুটা লবণমুক্ত
In the sub-district of Dakob in Khulna, an epidemiological study by Imperial College London and Bangladesh Center for Advanced Studies reveals that salt intake among pregnant women is well above the WHO and FAO recommended levels.
আমাদের গবেষণা শুরু করার আগে আমরা একটা পাইলট সার্ভে করে নিই যেখানে আমরা কোস্টাল এবং নন কোস্টাল রিজনের গর্ভবতী মহিলাদের স্বাস্থ্যগত তথ্য কম্পেয়ার করি
The study also found that their rates of hypertension and preeclampsia are considerably higher compared to pregnant women living further from the coast. A strong association was found between water sources and high salinity levels and the risk of developing these conditions.
প্রাথমিকভাবে একটা ফলাফল আমাদের কাছে আছে সেটা হলো ইউরিনে আমাদের দেখা গেছে যে যেটা স্বাভাবিক মানুষের শরীরে যতটুকু লবণ থাকার প্রয়োজন তার থেকে 7 গুণ বেশি ইউরিন দিয়েই পাস করছে যেটা কিনা অনেক বেশি ভয়াবহ
60% লোকে এই লবণাক্ত পানি পান করে আর লবণ পানিতে আপনারা জানেন যে সোডিয়াম ক্লোরাইড হচ্ছে লবণ এই সোডিয়াম ক্লোরাইড বা ম্যাগনেসিয়াম ক্লোরাইড যেগুলি আমাদের শরীরে ডাইরেক্ট অ্যাবজর্পশন হচ্ছে অ্যাবজর্পশনে রক্তে যাচ্ছে রক্তে যে রক্তের ভলিউমটা বাড়িয়ে দিচ্ছে তখন আমাদের প্রেশার সাধারণত
So we have looked at some of the long-term and chronic health impacts that water salinity is likely to have on populations that are exposed to it. So what can be done about this particular environmental risk? The main objective is to provide low-cost, pathogen-free, low salinity, and locally available water to the population. Some options and interventions are being explored. Among them is rainwater harvesting. Although rainwater consumption has a positive impact of low or no sodium intake, the amount of rainwater that is stored during the rainy season might not be enough to carry through the entire dry season. Managed aquifer recharge is another option that is being explored. Here, rainwater is stored in the groundwater during the wet season so that it can be pumped up during the dry season. But current evidence shows that there seems to be a steady increment in sodium concentration through the span of the dry season. Reverse osmosis is another option that is being tested. It is a water purification process that uses a semi-permeable membrane to separate water molecules from other substances. It provides an alternative lower salinity water source, but only for those who can afford it. Currently, the NIHR Global Center for NCDs is working in Bangladesh to assess interventions in salinity reduction. So if we think about the way forward, firstly, the results from the study that I showed need to be further validated through intervention studies to establish a causal link and also to look at dose-response functions between increased salinity and the risk of diseases in different populations. Going forward, raising awareness is extremely important. Many people exposed to high salinity don't even know that it's a health risk, other than the water being unpalatable for drinking. Water salinity is a public health concern that will continue to rise due to climate change, not only in Bangladesh but in many coastal areas around the world, and this may have chronic health impacts and increase the burden of non-communicable diseases. Therefore, raising awareness about the health risks of water salinity is essential for governments to frame policies and mitigation strategies to control this emerging threat. Adaptation measures are needed to promote alternative sources of drinking water, some of which I talked about in the previous slide. We can consider using climate-smart technologies that are sustainable in the long run. We could also look at climate-resilient health systems and strengthening primary healthcare systems. The WHO has developed an operational framework for climate-resilient health systems. This framework helps the healthcare leaders to design a strategic plan to adapt to climate change risks and to bring about sustained improvement in health. It underscores the role of primary healthcare to improve the preparedness and resilience of communities where primary healthcare facilities are located. Concerted effort by all stakeholders is important, and this includes the local communities that are affected, the government, the civil society, the private sector, health professionals, and academics. Lastly, exploring multi-sectoral approaches can also be effective in tackling the climate crisis and the adverse human health impacts. Solving the climate crisis is absolutely crucial, as it ensures that future generations will be able to enjoy access to fresh water, clean air, and the nature around them. Thank you very much. If you have any questions, do email me. My email address is listed on the slide below. Thank you.